Welcome back to the morning show here on Tobago Updates Television, and thank you so much for staying with us. We begin conversations this morning in studio, and we're speaking about a very, very important topic. Yes, and you want to be a part of these conversations, get in the know what to look out for, and know how to help yourself out of a sticky situation. We're speaking this morning with Dr. Victor Wheeler, gynecologist and obstetrician, and Dr. Shauntelle Winchester as well, also gynecologist and obstetrician. Good morning and welcome.
Morning.
Good morning.
Morning.
Right, it's a pleasure to have you here in studio with us this morning to speak on this very, very important topic. You know, there are some topics that people kind of skim over because they don't, the fear of knowing. And for me, I think the knowledge gives you the opportunity to deal with a situation that you might be facing or you can potentially face. And we're talking about cervical cancer awareness. And before we get into the awareness, we want to talk about what exactly is cervical cancer.
Good morning. So cervical cancer is cancer of the cervix. The cervix is the part of the woman's reproductive system that connects the uterus or the womb to the vagina. So we refer to it as the neck of the womb. This is when abnormal cells are developed at the neck of the womb, and then it can invade the rest of the body.
Mm-hmm. And you know, of course, when it invades the rest of the body, you're definitely at risk. Yeah, you're definitely at risk, and you want to take care of yourself. What type of what age group, is there a specific age group of women who would be at risk of getting cervical cancer?
Okay, so first of all, cervical cancer is a slow-growing cancer. It takes a long time to develop, and the causative agent for this is the HPV virus. So risk factors for this, the women who are exposed to this is women who are sexually active, because the HPV virus is a sexually transmitted virus. So if you are sexually active, then you are at increased risk of developing cervical cancer. So that is approximately age 21 to 65.
And I realize that you're cautious there in mentioning the ages, which I quite understand. But viewers, I want you to pay attention. There is a guideline for the age, but primarily once you are sexually active, you are, likely you are in the line of risk to get cervical cancer. So you want to make sure that you put that in the mix as well. Can cervical cancer be prevented?
Yes, cervical cancer is one of the most preventable cancers, and that is why we are here to raise awareness for cervical cancer. January, Cervical Cancer Awareness Month, and it can be prevented through regular screenings via pap smears and also vaccinating against the HPV virus.
Right, so you introduce now some of the things you can do to prevent it. So we're talking about a pap smear. What is a pap smear and how is it done?
Okay. So a pap smear is a medical procedure that is done to take a sample of the cells of the cervix and send it to the lab to be tested. How it is done is, I can do a demonstration here. So I have here, this is a speculum. This is the instrument that is used to place into the vagina. So we insert it into the vagina, and in order to visualize the cervix, and this spatula or the brush, these are the instruments we would use to obtain the cells and put it on the slide and then send it to the lab to be tested.
Right. And I want to talk a little bit about how have people, especially that age group you mentioned, cautiously, have women been coming forward to do pap smears? Do they understand the importance of having pap smears done and coming forward to do them on a regular and a consistent basis?
Well, there are many women who religiously do their pap smears when they are supposed to. Those are the very health conscious ones. Then there are other women who are afraid, just as Dr. Winchester said, are afraid of the procedure. It might hurt. But part of the reason for raising the awareness is to target those women who have never had a pap smear. Because the women who have never had a pap smear and have been sexually active, those are the ones that are at risk, because they could have something going on, and as Dr. Winchester said, it takes a long time to develop. So they could be there going along their merry way and a cancer is developing. The women who take regular pap smears, which is our protocol is every 3 years, tend to, if anything develops, it will be picked up early and it can be treated.
And how regular should you do a pap smear? Because I know there's a time frame that you're supposed to remain consistent over a period of time.
So in Trinidad and Tobago, our schedule, it is not advised to have a pap smear less than 21 years. The screening schedule is from 21 to 65 every 3 years. Once your pap smears have been normal, you can continue every 3 years up until 65. However, after 65, if you had normal screenings, then you can stop. If you had any abnormal screenings within that time, then the doctor will let you know your specific schedule.
And what if on your first or second or third screening you see something there? How is it? Is it as it is detected then you start to treat, or do you still have to continue having pap smears?
Yeah, so part of the reason for doing the pap smear is to detect abnormal cells. The pap smear doesn't often detect the cancer cells, because if cancer has developed, often you would see a growth. And the reason we stress the pap smear is that if you can identify these abnormal cells, then you would be sent to do what is called a colposcopy, which is a special procedure where you use a microscope to magnify the neck of the womb, and you can put certain stains on it. And if you see an abnormal or suspicious area, you can remove just that small part of the cervix and send it to be tested. If you test it and you get a positive result, meaning that there is cancer present, then that person is referred to someone called a gynae oncologist, which is a gynecologist who specializes in cancer treatment, whether you're going to have surgery, radiotherapy, or some other form of treatment, and that would depend on how far the cancer has spread. So by doing the pap smears regularly, you either identify it before cancer has developed, or if there's something developing, you catch it at a very, very early stage, where you can actually remove just a small part and prevent or even cure that person from the cervical cancer.
Based on your experience in this field and, conducting pap smears and having conversations with women in the age group that we're talking about, is there a specific age group within that age range that you have seen results coming back from the smear detecting any type of irregularity in their cells? Is that a specific age group, or does it span throughout the entire 21 to 65?
No. So cervical cancer is commonly, if it's going to occur, it tends to occur over the age of 50. And the reason why that is, it takes a long time. If you are exposed to the virus and you have abnormal cells, those abnormal cells can take 10 to 15 years of developing before cancer develops. It's rare for cervical cancer to develop in a teenager or a young woman because, as we said, you have to be exposed to the HPV virus, and that takes a long time. And we also don't do any pap smears before 21, because under the age of 21, the neck of the womb is still going through the maturation process. So there may be some abnormal cells that may be picked up on the pap smear that are not going to develop into cancer. So that's why 21 is the chosen age. But since I've been here, I've been in Tobago since 1996, and there has been a significant reduction in the number of persons that we diagnose with cervical cancer, purely because over the years we've been performing more and more pap smears. Women are getting more self-conscious. The young women these days are very well educated. Everybody's on YouTube, so they know what they're supposed to be doing. So what we're doing for January is just, there's just a little reminder that you should still be doing your regular pap smears. But we would like to let persons know, if you have never had a pap smear done, you should make sure you have one done this month.
And you mentioned that the cells take a long while to develop. Are you talking about possibly up to 10 years to
10,
develop,
15
10, 15
years.
years to develop?
10,
So this is
15
why it
years.
is important to start as early as possible.
Well, we recommend no earlier than 3 years after the first time you've had intercourse. Because even the exposure to the HPV virus, many persons, men and women, will be exposed to the virus, but our body's immune system will clear it and remove it from the body. It is those persons in which the HPV virus is not cleared and there's a persistent HPV infection. Those are the ones who are at risk of developing the cancer.
Very, very important and informative information coming out here this morning, viewers, and we do hope that you could continue staying with us. We have to go for a short break, but when we come back, we continue in this very same topic as we get more information. You can be a part of the conversation. We're going to open the phone line so that you can call in this morning to ask your questions. You can even ask your questions on our Facebook live stream as well, and we're going to go through. We have the professionals here in studio, and so we can get as much information as we possibly can to ensure that you know where you are, you know what you have to do, and you know that help and support is there for you. We're going to go for a short break, and in the meantime, we ask you to help us. Share the live, share the live, share the live. We'll be right back.
Good morning.
Welcome back to the morning show here on Tobago Updates Television, and thank you so much for staying with us. We continue conversations this morning, and remember the phone lines are open so you can call in, you can WhatsApp us, or you can even leave your comments on our Facebook live stream to be a part of this conversation. We continue speaking with Dr. Victor Wheeler and Dr. Shauntelle Winchester, gynecologist and obstetrician. We're talking about cervical cancer awareness and, of course, don't fear the smear. Before we went to break, we were talking about things that you can do to detect and prevent cervical cancer, and you also introduced the vaccine into the conversation. So let's talk a little bit about that as well.
Okay, so the HPV vaccine, since that we already found out what causes cervical cancer, the HPV virus, there is a HPV vaccine available in the public system for women and men, right? There are over 200 strains of HPV virus, but they have found out the high-risk types that actually causes the cervical cancer, which is HPV 16 and 18, and the vaccine actually covers for that. There are HPV 6 and 11, which causes genital warts, and the vaccine we have available here covers for both genital warts and cervical cancer, and this is available in the public system, in the health system. Now, I know that you're probably aware that a couple of years ago there was a lot of controversy about the introduction of the vaccine in young girls and boys, right? And this was because they wanted to target the population of children before they become sexually active, and that is between 9 to 14. Boys and girls between 9 to 14 were advised to have the vaccine so that when they start to become sexually active, they're already protected against the HPV virus. Women can get the HPV vaccine as well. They can get it up to 45 years old, and this is available in the public system.
I mean, when you introduce vaccine into a conversation, I know a lot of people, there's a lot of stigma where that is concerned. But if the research shows and the professionals say that, it can assist in preventing, or, it's something to consider as well. I mean, we talking about Cervical Cancer Awareness Month. This is the month of awareness for cervical cancer. So what are some of the things people need to be aware of? They need to know, how do they contact a professional? If they're not going to the public centers, where can they go? And is there a way that you can, outside of saying, listen, let me go and get my smear done, is there a way that they could say, maybe something is off and I need to go and get checked?
Okay. So pap smears are free in the public system at the health centers. You can call in, make an appointment, and have your pap smears done. Additionally, because it's Cervical Cancer Awareness Month and we really want to get all the women to get their smears done, At my private office, we are actually doing a promotion where you can call and make an appointment and get pap smears done at any day of the week of any appointment. So you can call in even on Sundays. We are trying to make ourselves available so that you can have the pap smears done. During the day, 8 to 4, you can visit TLH building, Dr. Wheeler's office to have it done. And in the afternoon, Saturday, Sunday, you can call us and we will provide the service for you just to have it done.
All right, so tell us the contact details that viewers can call to get.
So the office is located at Bukutang Center, Lux Medical Center, and the telephone number is 757-4053. You can use WhatsApp as well to make the appointment.
Right. Viewers, remember you can call in this morning. The number to call is 284-6597, 284-6597. You can also leave your comments or questions on our Facebook live stream, or you can also WhatsApp that number, 284-6597. Be a part of the conversation. Ask the questions that you want to get answered this morning, because we have the professionals in studio this morning, and they are able to bring some type of clarity to you, so that you are able to understand what is happening where cervical cancer is concerned, where you can get your pap smears done, how it is done. Earlier in the first segment, we saw Dr. Winchester doing a brief demonstration, or at least showing the tools that are used for the smear. I know a lot of women, especially the younger ones, who might not have done it before. I know Dr. Wheeler said a lot of people going on YouTube and they know what they have to do, but sometimes there's a stigma. Some people see the equipment and they're like, I don't want to. Or even men, sometimes they don't understand it. They look at it and they're trying to figure out, like, what is this and how does it work? And, I just want you to, as you're here, to kind of talk to our viewers in terms of bringing that measure of comfort and security to them, knowing that the tools and the equipment that you use, they're very safe. And I've come to realize that once you relax, it's quite simple. So let's talk through that part of the physical part of getting tested for your pap smear.
So first of all, I would like to say how a woman would prepare for the pap smear. So one, you try not to get the pap smear whilst you're on your period. If you're having any abnormal discharge, and you avoid sexual activity at least 24 to 48 hours before you present to the doctor's office. Preparing for the pap smear, a lot of women, because of the fear, some of them, you can bring a friend along for a support partner, or you can bring your partner, your husband, boyfriend, at the visits. You can form a comfortable relationship with the doctor. Let the doctor know, you're feeling a little bit anxious, so that they will reassure you as well. And the doctor will re-explain the procedure to you, and it's basically to relax. The pap smear is a very simple, easy procedure. It takes approximately 5 minutes or even less, and that 5 minutes or less can save your life through the preventative screening. So it is just 5 minutes. You go, you have it done, and that can prolong your life, because cervical cancer can impact your life for a lifetime, and it's not just you alone you're impacting, it's the entire family. So that 5 minutes can definitely save your life.
What are, in terms of the after having the pap smear done, and it's the cells are sent off for testing, how soon after do you get your results? And I know you mentioned if it's normal, then you don't have to test again for another 3 years. And if it's abnormal, then you get the advice from your doctor and they tell you what to do. So how long in the waiting period? Because, as you're talking about anxiety, if I'm going to get tested for something, what is the standard waiting period to get your results back?
Well, unfortunately, there's a difference between the time for the waiting, if it's done in the public service as opposed to privately. In the public service, it can take 6 weeks to 2 months, but privately, within a week to 10 days, you should be able to get your results.
And that is another conversation as well that needs to be had, in terms of managing expectations. So like if you go to the public healthcare system to get it done, knowing once the patient knows, it's a 6 to 8 weeks.
Yes.
I think that should be a part of the conversation, yes, so that they can manage expectations. Anxiety is low, so that, yes, they don't have to be sitting there panicking for 2 whole months, but just know that this is the normal standard
yes,
time,
yes,
for the results to come back. And as you mentioned, once the results come back, the patient comes in, you say, well, listen, Normal, nothing abnormal there. So
So usually there's a review. Depending on where you go, you may get a telephone call saying, look, we got your results. The results are normal. Your next pap smear is scheduled for 3 years. If, however, the pap smear shows some abnormality, not necessarily cancer, the doctor would ask you to come in to discuss treatment options. Sometimes the pap smear may show a very slight infection and they say, okay, well, we need to treat this and repeat this in a few months' time. Sometimes it shows some abnormal cells that are just mild and they say, okay, well, maybe you need to just have this repeated in 6 months or a year. Sometimes the results may show some abnormality that may require you to be tested for HPV, the human papillomavirus. So it all depends on what the results show, but in many places, if the results are normal, you'll just get a telephone call.
Dr. Winchester, you mentioned earlier when you were talking about reassuring the patient, and you're talking about, you could come with a friend, come with your partner, come with whomever. How important is it for men to also understand cervical cancer and the procedures that should be taken where that is concerned to provide that measure of support to their partners as well?
So it is important because, like I said, cervical cancer would affect everyone. And I am happy that you asked this question because we can advocate for the men to speak to their wives, their mothers, their daughters, to encourage women to have their pap smears done and to have it done regularly because it does affect everyone.
And I like that you introduced that into the conversation, because sometimes when we deal with a matter, we only deal with the group who is directly affected, and we don't talk about the village, around that person. So it is very important for all of us to have the information as it relates to that. Remember, the phone lines are open 284-6597. You can call in and ask your questions. But in the meantime, we continue talking about cervical cancer awareness. Remember, the age group for testing is 21 to 65, and Dr. Wheeler explained earlier in our first segment, the reason is because at 21 or before 21, explain to them again.
The cervix, the neck of the womb, is still going through its development process. So if you do a pap smear before that time, it may pick up cells that may be abnormal but not related to cancer. And so that's the general reason why it's not done before 21. But the other thing is, first of all, if you've never had sexual intercourse, we don't recommend pap smears. It's virtually impossible to do it. And we usually recommend 3 years, no earlier than 3 years after your first sexual encounter, because even if you did get exposed to HPV at that very first encounter, it does take a number of years before any changes will develop on the cervix or the neck of the womb.
And this conversation, I think, was very, very thorough in terms of explaining what cervical cancer is, in terms of explaining how to have your pap smear done, the vaccine, what is expected after the screening, the phone call, and even patient care. So I want to say thank you so much for coming this morning and having that conversation. And enlightening our viewers this morning about the whole process, and of course encouraging the village to come out and support persons who are supposed to be getting their screening 21 to 65, and of course managing expectations as it were where that is concerned, right? So ladies and gentlemen, we're going to go for another short break before we continue. Oh, there's a caller online. I'm sorry, I'm being told that there's a caller online. Caller, good morning and thank you for calling.
Hi, good morning. I'm just going to find out how aggressive cervical cancer is.
Right, so the caller is asking how aggressive is cervical cancer?
Right, so cervical cancer, well, first of all, we say that it is very slow to develop. But once it has developed, the cancer can spread from the neck of the womb to the body of the womb, to organs in the rest of the pelvis, the bladder, and if it's there long enough, it can spread to distant areas like the lungs. So primarily because the cervix is the one organ that is relatively easily accessible, and it also goes through an abnormal phase before the cancer develops. That is why cervical cancer is one of those cancers that you can truly prevent and actually eradicate. Certain first world countries have actually eradicated cervical cancer from their population from a combination of vaccine and regular screening of the women for cervical cancer, so that you can identify it in the phase that lasts for several years where they have normal cells, but cancer has not developed.
Cole, I hope that satisfied your question. And the cancer is really an interesting thing to learn about in terms of how it develops, how it spreads, how it can be eradicated as well. And I do hope that people take a greater interest in their health first and foremost, and especially in cancers, because I know sometimes some cancers are hard to detect, and here we are encouraging people, we can detect this and eliminate it,
Yes.
prolong your life as you mentioned, and have a better quality of health as you live on this planet called Earth. We can enjoy each other, we can enjoy the beautiful things that were created for us once we take the necessary steps of doing the screening and all that we need to do to ensure that we remain in a healthy place. Are there any other callers in line? Remember, callers, you can call 284-6597. In the meantime, we're going to continue this conversation, but we have to go for a really, really short break before we come back. Do stay with us, and as we go, we invite you to help us share the live, share the live, share the live.
Join us this Thursday, January 9th at 5 p.m. for a special year in review program. We'll recap the significant strides made by the Division of Infrastructure, Quarries, and Urban Development. Hear directly from Assemblyman Trevor James and Assemblyman Terrence Baines as they discuss the successes, challenges, and future plans for Tobago's infrastructure. Don't miss this opportunity to learn more about the transformation of Tobago's landscape. Tune in live on Tobago Updates Television.
You can now get whatever you need whenever you need it anywhere in Tobago with Tobago. Your meals, medication, groceries, and shopping all delivered directly to you. No more hassle, no more stress. Get the Tobago app today on Google Play or Apple App Store.
That's TAPPOGO, and let us deliver to you.
Check our website at www.tapogo.app or call the experts at 494-TOGO and 484-4746. Tobago. Relax. We will get it to you. Tobago's at your service.
MI4 Security Services Company is the most advanced security service in Tobago. Ask about our cash and transit service. It's safe, risk-free, reliable, and timely. We provide safe banking delivery for all business types and sizes with highly trained staff, 24/7 monitoring, coordinated emergency response, and a well-maintained fleet of armored vehicles. Contact us at 660-7723 or visit our website at www.mi4securitytt.com to sign up today.
Want to get better? Where to start? What kind of exercise to do? What to eat? How to get restful sleep? Need a doctor to search for root cause? Look no further. Come to Majuba Hill Lifestyle Center Foundation at our Wellness Center in Goodwood, or Food Hub in Darrow Springs, Scarborough, or Doctor's Office in Goodwood and Darrow Springs. Contact 49 Swift 4979 438.
About 7:46 a.m. So if you're getting yourself to work for 8 and the children to school, remember to drive safely on our nation's roads. We want to get there safely. Consider yourself and the pedestrians as well. All right, we continue conversations this morning in studio and we stay with the doctors. Yes, Dr. Victor Wheeler and Dr. Shauntelle Winchester. As we continue the conversation this morning, we're going to switch gears a little bit and we're going to introduce fibroids into the conversation this morning. So Dr. Wheeler, talk us through what exactly is fibroids and how does it affect the woman?
Right, so fibroids is a benign or non-cancerous condition that affects the uterus. It's very common in women, even more so common in women of Afro-Caribbean descent. And very often a woman has fibroids and does not know that she has any fibroids. But when the fibroids do cause problems, it will cause things like periods being heavy, periods being painful. The periods could be longer than normal. She could notice a swelling in her tummy. The fibroids, if you happen to get pregnant with fibroids, the fibroids can cause a miscarriage or for you to deliver earlier than planned. And the presence of fibroids can also make it difficult for you to get pregnant. But it's important to check because it can also cause you to become anemic. Women find that the periods are heavy, they're becoming anemic, and they don't understand. And when they do get a check, the womb is enlarged and they have a fibroid. Now, the way of detecting it, when you have when you go to your doctor, the doctor will want to examine the womb itself to see if it feels enlarged or not. And if it does feel enlarged, then you will be sent to have an ultrasound scan to see. That ultrasound is something that will show if there is any abnormality in the uterus itself. And there are different options for treating the fibroids. You can have medication, tablets, if you just pain and heavy bleeding. There's medication to shrink the fibroids down. There's also, if the medication doesn't work, there's options of surgery to remove the fibroids. And the one way of totally clearing all the fibroids would be to take the womb itself out by performing a hysterectomy. But that is really a last resort in the different options you have for treating fibroids.
And how are fibroids developed? How does somebody get fibroids?
It's really genetics because if your mother or your sister have fibroids, you could develop fibroids. The actual cause of the fibroids is not quite known. Persons say if you eat lots of red meat, you can get fibroids, but that's really not so. But it's very common in the population.
And you're talking about if you can take medication to reduce the size of the fibroid or surgery to remove them or extracting the womb. If you, let's say you take medication, the fibroid shrinks or it disappears, is there a possibility of it reappearing?
Yes, the medication that is available to shrink the fibroids only acts while you are taking the medication itself. And often we would use that. So let's say, for example, someone is very anemic, having heavy bleeding all the time. You could use that medication to shrink it down and stop the bleeding to allow that person to build up their blood count. And other times the fibroids are so large, fibroids can grow as large as a football. And if you're going to have surgery, then the cut on the tummy is a large incision. Sometimes the injection, the medication is used to shrink it down so that if you have to remove the fibroids, it's a smaller cut and you tend to bleed less. Persons who, one thing that I should mention is that when you reach your menopause, the fibroids tend to shrink, because what causes them to grow is the estrogen being produced from your ovaries. So at menopause, when you no longer are producing estrogen, the fibroids shrink. Sometimes a year or two before menopause, your fibroids are large, causing problems. We may use the medication to shrink the fibroids down, such that if your menopause is coming along in a few months, the shrinkage will just continue naturally. So it's not always necessary to have surgery for fibroids. There are alternatives to it.
And I was going to ask, what do they feed on? And you mentioned the estrogen is what causes them to...
The estrogen is what provides the blood flow and what the fibroids feed on. Because if a woman gets pregnant with fibroids, the same way the baby grows in the womb, the fibroids also grow. But then after she gives birth, when the baby is delivered, because the amount of estrogen is being produced is reduced, the fibroids shrink after giving birth. Which is why it explains why after the menopause, when you're no longer producing estrogen, fibroid shrink.
So the chances of the fibroid coming back, let's say you've had the baby, let's say you were fortunate to have a baby while you had fibroids, the fibroid shrunk, baby came out, the fibroid is small. And that period of nursing and, has passed. The fibroid has shrunk. It hasn't disappeared. It's still there, but it's smaller. Will it grow back again as you start to produce?
Depending on how, let's say someone were in the 20s and the fibroids would shrink after they give birth. You have many more years of exposure to estrogen. So it is likely the fibroids they don't always, but they could grow larger. And this is when it comes to surgery. Some women say they've not tried to get pregnant before. They have fibroids. They want all the fibroids removed before they try it. We don't encourage that because we don't know how long you are going to take to get pregnant. And if you have surgery to take it out at an early age, and 10 years before you get pregnant, you are likely to have more fibroids growing back. So that's why we talk about the surgical part of it, which was quite commonly done before. It's not advocated as much these days because there are alternatives.
I was never aware of this, so I'm happy to have this conversation and to bring this into the conversation, knowing that the estrogen is what the fibroids feed on to grow. And it really is amazing that you're saying that you can still become pregnant, and in fact, when you get pregnant and you have the baby now, the fibroids will respect that, and of course, if I could use that term, and it will shrink and be more manageable in that period of nursing. You also did mention that there's no known cause for fibroids except it being hereditary, and so I don't know. For me, I am looking for some sort of comfort and assurance that I might not be getting fibroid anytime. There's not in my family line, but for the person who might have it in their bloodline, it's kind of concerning to think, wow, there's no known cause, so there's nothing you can really do to prevent it from happening. In terms of management, there's the medication. Are there other ways that you can manage living with fibroids?
So first I should say, many women have fibroids. They have as many children as they want. They live normal, healthy lives. They may not know that they have fibroids unless some other problem develops and it's coincidentally found. So the main thing is just the mere presence of fibroids is not a problem. If you go for a checkup and it's detected that you have fibroids and you are not, periods are normal, you had 2 or 3 children, you're not having pain with the periods, everything is normal, there's no need to do anything to it. It's only when it's causing a problem to you, then you would need to have it addressed because it is so common.
And you did mention that it is not malignant, so
it's not cancerous.
Right.
However, women, you can develop uterine cancer and have fibroids, but the fibroids themselves are not something that will go and develop into cancer.
I wish we had a little bit more time to continue this conversation because I'm getting educated here where this is concerned, and I'm happy that our viewers are locked on our live stream as well. In closing, what are some of the things you want to share with our viewers in terms of both fibroids and cervical cancer, in terms of getting themselves tested, just general information they should know as we move forward?
So it's a new year, and I know that a lot of us would have had New Year's resolution, males and females. So we can take this opportunity to take your health very seriously. If you've been having heavy bleeding or anything, any problem that you've been concerned about, you can visit any of the health centers and let them know. You can visit the private offices to get that checked out. January is Cervical Cancer Awareness Month. We learned this morning that it can be prevented through regular screenings. So if you know in the back of your mind that you haven't had your pap smear or you never had a pap smear, please try to get one. For the men, please encourage the woman, just like how you would give them money to go and do their hair or the nails or whatever, you let them know, hey, go and get your pap smear done. You can make the appointment for them to get the pap smears done. Thank you for having us.
Of course, indeed a pleasure this morning having this very, very important conversation. Thank you so much for joining us. Ladies and gentlemen, we've been speaking with Dr. Victor Wheeler and Shauntelle Winchester, gynecologist and obstetrician, as we spoke about cervical cancer and fibroids, what you should know and what you should do to preserve your health and your life. This is where we end the morning show here on Tobago Updates Television, but it's not where we end our programming. We head on over to GMT, that is Good Morning Tobago, and we do hope that you can stay with us. And as you stay with us, we invite you to help us share the live, share the live, share the live.